bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Well, thank you for joining us. There are people around the world who otherwise would not get medical care if it were not for people who specialize in that kind of thing from this country, who donate their time, who go to help people who otherwise would not have any help. And one of those folks is Dr. Henry Hamilton. He's here. And what you were telling me about traveling to other places in the world and putting groups to be together to help these folks, you've got a whole entourage of different people who specialize.
Yes, we have been doing this for about 10 years, and we put a team of sometimes plastic surgeons, general surgeons, OB-GYNs.
Like yourself?
Like myself. I'm an OB-GYN in San Mateo. And we generally, somebody will ask from the host country will ask us to come. We'll go and survey the place and go down, and sometimes we go down for 2 or 3 years in a row, or 2 or 3 every 6 months. We try to do about 3 to 4 missions a year.
For example, where would you go?
We go to the Philippines for the past, actually 14 years. That's where we really got started. And then we go to India. We've been to Peru 3 times in the last 2 years. Guatemala twice in the past 2 years. Yeah. Africa, we're going to Africa in November. And in those places that we're going to, we mainly take care of women. My job is to take care of women who have bleeding problems, tumors, and as a consequence, they're kind of cast out. And so they're not much use to their family members. So we patch them back up, and we remove their tumors, and they can go back to work and help and have babies. And
this to me, I really want to ask you this, because as someone who practices here in the peninsula and then goes to these different countries, it's got to give you a kind of perception and insight that a doctor who didn't do that would not have. Don't you, when you go to another country like that, or people who need help, and then you come back here and it's someone from Redwood City, and then it's someone from an obscure place in the Philippines, and what does that do to you psychologically?
Well, it's a great leveling of playing field, because you realize that everybody's the same. Everybody bleeds red blood, and everybody has the same problems. And so they look at you, as me, just as the mechanic who can fix things. And so we fix things. But we also, in these different locations, we try to get the doctors, the local doctors, we try to upgrade their skills. We bring medical students from the United States or just students from the United States, and trying to introduce them to medicine and try to light some fires under them and try to get them excited about giving.
You mentioned India. I mean, India is advanced in so many ways. I'm surprised to hear that. Is it the caste system that brings you there? What is it?
It's socialized medicine. Socialized medicine promises a lot but fails to deliver. And same thing in the Philippines. They have hospitals, they have doctors, they have wards, they have beds, but all the ancillary things that all the perishables cost, like medication, IVs, fluids, bandages, anything such as that. And the patients don't have any money. They can't afford it. Everything else is free, but they can't afford the little that is charged. So we go and we bring the medicines, we bring the IVs, the solutions, and we patch them up.
Okay. Well, and the name of the group is called what?
MedLend.
MedLend. So, okay. Just want to make sure you got that correct. Congratulations on doing that work.
Oh, thank you. Thank you.
We have a lot of fun. It's important work. It's important work. Dr. Henry Hamilton's been our guest. Thank you very much for joining us.
Thank you.